Welcome to Friday Friends, RI Elder Info's weekly look at the organizations and individuals providing resources for Rhode Island seniors, caregivers, and professionals.
Good morning, all my fabulous friends. Welcome to Friday Friends. I am Deb Burton, the founder and creator of RI Elder Info and rielderinfo.com. And every week I come on here at 9 o'clock on Friday and share with you some amazing organizations that you really need to know about. And if you don't need to know about it, I can promise you that somebody you know needs to know about it. So it's really important that you hit the like button and the share button to help get the word out, because we are all in this together. Well, we are a 501c3 nonprofit. We come every Friday thanks to our sponsors and our donors. So we are super grateful for Oak Street Health. Oak Street Health has locations in Warwick over by the Stop and Shop and Christmas Tree Plaza, in Providence, not far from the old St. Joe's Hospital, as well as by the McDonald's on Branch Avenue, as well as up in Woonsocket on Diamond Hill. So they have community centers that have computers. They're open to the public. They have the COVID vaccine available for individuals. They're a really great program, and I encourage you to reach out if you are looking for a primary care provider. One of our other sponsors is also United Healthcare. United provides a wealth of resources for individuals receiving the Medicare benefits. So it's open, almost open enrollment time. So you might want to check out United Healthcare. We are also very grateful to the magic that is happening behind the curtains here. D&B Media, Ben Barber, he is the one who makes sure that all of this looks good and that we get the information running properly down below. Make sure that I see everybody's questions in the chat, and you are welcome to ask as many questions as you like with our guests. And England Studio is responsible for maintaining the rielderinfo.com website and making sure that you're aware of all the fabulous things that we're doing out there in the community. I cannot forget Tamarisk Assisted Living, Little Assisted Living right over by the mall. Reach out to Susan or Sean if you need assisted living services. They will take care of your loved one like their very own family. So today I'm very excited to welcome two friends of mine that I know and do a lot of things with out in the community to do advocacy and make sure that our older adults get the resources that they need. So I'd like to welcome Chris Gadbois and Robyn Earley of CareLink. Good morning, ladies. How are you? So tell everybody, what is CareLink?
Robyn, do you want to start?
Sure. So CareLink is a membership organization, and our members are all nonprofits that provide everything from home care to long-term care to supported senior housing throughout the state of Rhode Island. CareLink also wears another hat of being a direct service provider for rehabilitation services, and we are the largest safety net provider in the state of dental services, mobile dental services. In addition, over the past year, we've increased and offered more mobile services on site within people's homes in long-term care and assisted living, and those include audiology and podiatry.
Holy cow, you guys are covering the full spectrum there, from podiatry to dental to the other types of care. Tell me more about the services that you're providing in these places. Where do people get these services?
So as Robyn said, since 2008, CareLink has been the primary and the only nonprofit provider of dental services in nursing homes and assisted livings across the state. And we bring the equipment in, our dental professionals, dentists, public health dental hygienists, and assistants bring the equipment in on a van and set up in a space within the facility. And then the residents just need to walk down or wheel down and be able to see their dentist or see their hygienist for a visit. As Robyn said, during the pandemic, we found that folks were really, residents of long-term care facilities were really struggling to get services that they needed because of some of the restrictions due to infection control with the pandemic and being able to travel. Folks were going without podiatry visits and without getting hearing aids that they needed. Infection control with the pandemic.
Sorry about that.
Being able to travel. That's okay. Technical. So we were able to quickly utilize the infrastructure that we have for the dental services. We already have the connections with all these facilities, which is very important because we work closely with the medical directors and the director of nursing in the facilities. So we leveraged those connections and the systems we already had in place to add the additional services, as Robyn mentioned. And right now we're working really hard to set up consultative psychiatry services and optometry services, because we know that those are critical as well. So we hear from patients asking us, for the services they need, and we hear from directors of nursing and medical directors asking us for services. So we try to be responsive to that.
That is amazing, because I don't think, a lot of times people realize when your loved one is in long-term care, we still need to get all those other services that we participate in regularly when we're in the community. We still need to have our eyes checked. We still need to get our teeth cleaned. And it can be much more difficult. So I think, during COVID, with the protocols in place, they didn't want folks, potentially leaving the facility and getting exposed to the virus. I think the service you're offering is amazing. Is it available to all of the residents in the facility, or do you have to have a particular kind of insurance?
We accept all insurances, and some folks private pay. I think folks are all aware that there's a lot more limited coverage for dental care than for other medical services. Mm-hmm. And Medicare, of course, still does not cover dental care. And so this means that many of the folks that we see are reliant upon Medicaid to cover their dental services, which is a little bit of a challenge because Medicaid rates tend to be a lot lower, which is, keeps a lot of providers from serving those folks. But the other important thing that folks maybe should think about, and I hadn't really thought about until I came to CareLink a couple of years ago and really started to dig into this. Older adults, but at age 65 usually lose their dental coverage when they stop working. And a lot of folks make the decision not to continue to have regular preventative dental treatment in their 60s and 70s. And so when folks are in their 80s, and that's the median age of our nursing home population, they've perhaps gone for almost 2 decades without preventative dental care. And so the folks that we see in the nursing homes oftentimes have dental issues that are far more extreme than our typical community provider would see.
Oh, wow. Okay. So you can do some really involved stuff.
But you don't really think about it.
Yeah. And I think, there's this awful stereotype that, as we get older, for individuals who are in long-term care, or even pre-long-term care, that at a certain age, our teeth simply go into a cup at night. And that's not the case anymore.
Right.
We are keeping our teeth. We do have, fluoridated water. We have better hygiene knowledge than maybe our great grandparents did. So that's something that's absolutely critical. So, and also podiatry services. How often are you able to provide podiatry services? So for the folks who don't know what podiatry is, that's taking care of your feet. The foot doctor, also known as.
You want to take that one, Robyn?
Sure. So typically with podiatry, individuals are seen every 9 weeks. So it's a pretty regular schedule unless there's something that comes up that's a bigger concern and needs a more rapid visit. But it's usually a pretty regular schedule, and individuals who have difficulty with chronic disease that makes them at risk for foot problems oftentimes need the podiatrist to see them and assess them and make sure that it doesn't become a larger problem that affects their overall health.
What kind of chronic diseases might somebody have that can really impact their feet?
Well, diabetes is the big one.
And any sort of peripheral vascular disease. So even folks with, chronic hypertension and cardiac disease tend to have that swelling, that edema that causes the breakdown in the lower extremities. Yeah.
Okay. So if you have heart disease, if you have diabetes, if your feet swell, it's really important that you get in to see a podiatrist or get in to see a foot doctor so that you guys can make sure that there's not like maybe a cut on the bottom part of the foot that's getting infected and not healing. And that's when you start hearing when you don't have that proper care of people losing their toes and things like that, right?
Unfortunately, yes.
Yeah. Mm-hmm. Yeah. So that's something that's really important. And it's not, our teeth are absolutely important, but when we can look in the mirror and see our teeth, not everybody has the flexibility to bend their leg around to see their toes and the bottom of their feet. So it's really important to be able to get that kind of care for folks. In your podiatry services, are you able to connect people with the orthopedic shoes, the special shoes that some folks need?
It's funny you asked that. We're actually working on that right now. We have a team of folks trying to figure out how we could better provide the orthopedic shoes and orthotic devices.
That's awesome. And then, so you can get, or you will be able to get the special shoes for folks who can take care of their feet. One of the things I've heard about a lot during COVID is when people have been hospitalized for a long period of time, maybe they've had to be ventilated, that kind of thing, that they're really having some issues afterwards with speaking and swallowing. Do you guys offer any services in relation to that?
I'm going to defer to Robyn, who, in addition to being an administrator with us, is a licensed speech and language pathologist.
So, yes, most definitely. That we've learned that individuals who, certainly somebody who undergoes mechanical ventilation or a tracheostomy, any kind of altered airway or change in their normal respiratory condition can have a post-COVID impact. Fortunately, we have a team of speech pathologists, in addition to occupational and physical therapists, that our knowledge about some of the issues that people can have after leaving the hospital, whether it be in short-term rehab or with some of our partners in the home care setting or an outpatient. And be able to address those because, we've all heard of the COVID long haulers and how people just don't feel, everything from, difficulty with their respiratory and feeling deconditioned overall to having that brain fog and not quite thinking right. And, making sure that people are able to resume safely where they were before, getting back to being independent and doing the things that are important to them is critical and a core value and mission of our rehab team.
That's really important. I'm hearing about folks who have spent an extraordinary amount of time in the ICU and then in the hospital afterwards. And I would imagine, after that, your body as a whole is deconditioned, I know if I spend the weekend, binging on Netflix, come Monday morning when I got to get up and move again, my whole body is like, ugh. So if you've been in the hospital, you've had difficulty just like being able to just breathe, that it takes some effort to get you back up to at minimum baseline. So what kind of services can you do for that?
It's interesting you say that, Deb, because we've worked with our partners over at the Geriatric Education Center at URI, and our therapists have been part of creating specialized training for therapists across the state and for primary care providers on how to provide the specialized rehabilitation for just what you're describing. So our therapists are not only providing that, but they're teaching others, other healthcare professionals how to do that. So,
oh, that's amazing. And that's, that ripple effect of we get the information and then to share it out. That's how we make an even bigger impact on the community. For some folks, their baseline level of being able to walk well maybe was not as good as it could be. So if somebody has a loved one in a facility, can they ask for CareLink services?
Absolutely. We oftentimes have family members reach out directly.
Okay.
We do then follow up with the facility because we do need permission from the facility. They have to help us to facilitate those visits. We need a space to set up, and we need to make sure we follow all the appropriate infection control protocols in collaboration with the facility.
Mm-hmm. So good question here. You mentioned infection control and that kind of thing, and the Delta COVID variant is out there, and the governor has issued the mandate that everybody will be vaccinated. Everybody who is governed by Rhode Island Department of Health will be vaccinated by October 1st. Do you anticipate being at 100% vaccination rate by October 1st?
We do. All of our staff are licensed by the Department of Health, and we've already got even before the mandate, we're over 85%, and we do expect to be at 100% within the next few weeks. Yeah.
Good. So people know that if they're working with a CareLink member, that they're going to be safe. That's really important.
Absolutely.
So what types of facilities do you work in? You had mentioned nursing homes. Do you do any work in any of the assisted living facilities or the high rises? What other areas do you provide services?
We do go beyond just the long-term care facilities, and we do provide services within many of the assisted livings. And I know over the past couple of years, you've seen that many of the assisted living communities have started to provide on-site rehab, because when you move in, you really want to be able to access services where you live. And if that's your new home and your new community, transportation is always a challenge, even if there's a community van. And so being able to access conveniently all three rehab disciplines and other on-site services makes life a little bit better, perhaps for individuals who are used to having to drive everywhere. And as you get older, you have more doctor's appointments. And so you want to be able to use the van to go out and do fun things rather than be going from appointment to appointment. So we're trying to bring our services into communities such as assisted living to make that a little bit easier.
And you make a really, really good point that, as we get older, we do have more medical appointments, but we still want to have fun. It's not just all about, visiting the doctor. That's not my definition of a fun kind of day. I can't imagine that that's going to change for me as I get older. I don't know. Maybe my doctor's really good looking, but maybe not, not the same as going out to have a coffee with my friends. So being able to receive those services in your home, you can reserve those trips for real fun things.
The other setting that, just to add, we work with partners in adult day health, Cornerstone and other adult day health providers, to bring services right to the adult day health, because I think your audience, Deb, sometimes has folks who, like myself at times, who have cared for our family members and have relied upon adult day health as a really good, safe place for that older adult to be during the day. And it's a wonderful relief to be able to have some services, rehab appointments, or even podiatry appointments happen at that adult day health while, I'm at work. My loved one can be having not only a safe and hopefully a little bit of fun day, but also get some medical appointments. So we've been definitely partnering with adult day health as well.
Adult Day Health is one of those really amazing programs that can really provide the care and activities that can keep people engaged and help them remain living at home in the community longer. But the side benefit to that is how the Adult Day Health program really can help support the caregivers. And, we know that in Rhode Island, we have the temporary caregiver insurance program. So you can take time off care for your loved one. But there's only but so much time that you can take out of work, before your boss is like, this is kind of a problem. And Adult Day Health, it's a full day program that people can attend. So with CareLink providing the medical appointments, that's one less thing that a caregiver needs to take time out of work to say, oh, I got to take my mom to the podiatrist today. Oh, next week we have to go to the dentist. Oh, the following week and it's like one thing after another.
Right.
And, caregivers do a lot. In Rhode Island, caregivers provide over $1 billion of free care that we don't often acknowledge enough. And so to have CareLink be able to provide these resources in the Adult Day Health, I think is absolutely amazing. Do you guys do any programs? Are you offering any programs or anything special for the caregivers of folks who are participating in Adult Day Health?
Actually, we recently received a grant from the Office of Healthy Aging to provide technology and tech support for the caregivers of individuals in Adult Day Health. And we are fortunate we have an extension on that grant. So if there is a caregiver out there, or somebody who is taking care of someone who's in Adult Day Health, we might have some free technology we can give you. So please let us know. We'd be happy to see how we could help out.
When you say free technology, what kind of technology could a caregiver get? What is it?
So cell phones and tablets.
Okay.
We had a lot of the cell phones are really popular initially, so we have mostly tablets left. But if someone's desperate for a cell phone, we'll find one somewhere. So because we know that so many resources now, such as this show, are online. Yeah. And so being able to access those resources, everything from being able to make your life easier by getting grocery delivery to finding the best doctor to care for your loved one, a lot of that is online. And so being able to allow someone to maybe you get a free piece of technology equipment so that they don't have to use their resources on that and they can use it for something else. We're trying to just help people access those resources.
If somebody wanted to participate, if there's a caregiver out there who would likes the idea of having a tablet, but they're not familiar with how to use it, and maybe they're a little intimidated and they're afraid they're going to break it and hit the wrong button or something like that, do you offer any kind of tech assistance or tech training or tech support, kind of like beyond, here's your on-off button, this is what else you can do with it? Yeah,
that's about where I'm at, right? We are fortunate in the state of Rhode Island to have the URI Cyber Seniors Program be such an amazing program. And so when we are giving out the technology, we give individuals kind of a startup, a couple of pages that explain to them how to turn it on and how to do some of the basics. But more importantly, we link them up with cyber seniors who can walk them through and be kind of the help person at the other line to really get them up and running with technology. And if they get stuck, and we've all been there, stuck with technology, you have somebody that you can call and really help you. And cyber seniors, they offer so many programs. And then the other thing I'll mention is that the Rhode Island Attorney General's office made some fantastic resources for internet safety. And so we hand those out with any piece of technology that we're giving individuals. And it's, just some common tips and helpful information about how to keep yourself safe online.
That is awesome. I didn't know about the tip sheet. I will have to reach out to them to get that because, I get so many of, hi, Deb, you have won $1 million, but there's just a little transfer fee. If you give us your credit card number, it'll all be good. You'll get $1 million out of it.
Right.
We want to make sure that folks get the tech, but then they're safe about it too. And you're right. The Cyber Seniors program is absolutely amazing. It sounds like you guys are connected all over the state with some really amazing programs. And you had mentioned you're in the community as well. So adult day health, it's assisted living, it's nursing home. Have I missed any?
There's our outpatient clinics. And we have one open in East Providence and we have one open in Newport. And we're fingers crossed, hoping to open one soon in Cranston and
in North Smithfield.
And in North Smithfield. So we're within those clinics, we would provide physical therapy, occupational therapy, and speech therapy, and also some of our specialty programs, such as the LSVT Big and Loud for individuals with Parkinson's disease, dementia intervention programs, and so forth. So we're excited, and our fall prevention programs, which we're really trying to offer throughout the state. We're writing grants furiously to try to get funding to offer
money.
To offer those programs free to individuals in the community who are a little bit concerned about their safety and, being able to walk around and be independent.
Yeah, that's falling. I tell people all the time, preventing a fall is your best way to remain independent at home for as long as possible. That's, it is a bit of a stereotype, but it really is true that if you fall, your chances of needing long-term care sooner is growing. So participating in these activities to prevent the fall, if you are an individual with Parkinson's disease, Parkinson's lends itself to having difficulty with the motor skills. So having an opportunity to participate in the Big and Loud program, a lot of times too, people are really concerned about dementia and getting dementia. So having a place in the community where they can go to work on preventative measures, to stay engaged, that's really important. Will your community centers, will they have the podiatry and the dental services as well on occasion?
We haven't really figured that out yet. We've got them set up to have our physical therapy, occupational speech, and the specialty dementia and Parkinson's interventions. But we have been considering, whether there's an opportunity to have enough patients that want it, that we could set up a clinic on certain days for podiatry or the like. Okay. I just wanted to mention, as you were talking about the importance of fall prevention, Deb, Robyn, every time you say the numbers, I am like blown away. The evidence regarding the improvement or the decreased risk that patients have if they follow certain evidence-based programs. Can you tell us that, Robyn? Because it's always staggering.
Yes. So one of the programs we offer if individuals go through and participate in this program, it's Tai Chi Quan Moving for Better Balance. There's a 57% reduction in the chance that the individual will fall. And I know. So, I wish we could get so much bang for our buck with other things, but, so this was, it's just a really impressive program. And it's something that we've started to provide within some of our member organizations. But like I said, we're really trying to push that out into the community and be one of the key providers at senior centers and so forth.
That's awesome. So if people wanted to reach out to you, how do they reach out to you? What's the best way for them to reach you?
Well, the easiest way is probably email, if that's convenient. And we try to make it easy by doing just info@CareLink, CareLinkRI.org.
Now, are you guys in other states? CareLinkRI.org?
Nope, we're focused on Rhode Island, 100%.
Awesome. So
yeah,
people need to
the
reach
reason
you.
for the RI tacked on there, Deb, is there's a CareLink out down south or somewhere.
Oh, yeah, one of those shared name things, but not the same. Yep. Get it. I totally get it. Carrie Lynn asked, what is the minimum age to take advantage of some of these wonderful programs?
That's a really good question, because one of the things we've started to do just within the past 6 months is push out into group homes for people with other types of disability, whether it be intellectual disability or other physical disabilities. So we are starting to see some younger adults. So there's really, and unfortunately in some of the long-term care facilities, there are some younger adults who have had a stroke or some other, accident. And so really there's no lower age limit, although, we definitely specialize in older adults and people with disabilities. We're not so good with the kids.
Not yet. But still, like this is amazing, the resources that you're providing, from speech and language and podiatry and dental services and PT and OT right in the facility that someone may live in, or the assisted living, or right in the community. This is amazing. So
Deb, I wanted to mention one thing that we did just partner with another community-based provider, the Parkinson's Place. And so that's actually going to be our newest, we're not quite open yet, outpatient community center. So you'll get PT, OT, speech, and of course, LSVT, big and loud, will be the key focus there, in addition to the exercise programs that the Parkinson's Place offers.
That's awesome. They're right over on Airport Road.
Right.
Yeah, that's great. So with all this stuff that you guys are doing, are you for profit? Are you nonprofit? What is your funding stream?
We are nonprofit. We depend on reimbursement from all insurers, but primarily Medicaid. Approximately 2/3 of our work is in Medicaid, where the reimbursement is historically much lower than other payers. So we do also try to do a lot of grant funding. Robyn and I work full tilt on identifying grants and trying to convince organizations that they should fund some of these important programs.
Yep. If there are people out there who either want to volunteer for your organization, or if they feel that it is important to ensure that individuals get the proper care, get their dental care, get their podiatry care, if folks wanted to make a donation, do you accept donations from the general public?
Absolutely. We'd be thrilled to work with anybody to in any way that they're interested, whether it be in an advisory role, whether it be as a volunteer, or whether they'd like to make a donation to a specific program or help us create and fund a certain program at, their special senior center. Absolutely.
Awesome. Well, I am so glad that you guys came on today. The amount of resources that you're providing out there for folks is truly amazing.
Thank you.
Thank you so much for coming on. I appreciate it.
Thanks for having us, Deb. You do great work.
Thank you. All right, everybody. Isn't that amazing? Speech, language, physical therapy, occupational therapy, dental's huge, podiatry, so you can get your foot doctor right there where you live in the long-term care setting, nursing homes, assisted living, and now even in the community centers, the adult day health programs. And don't forget, if you are someone who has a loved one participating in an adult day health program and you want to have access to a free tablet or cell phone, reach out to CareLink. They're absolutely amazing. So that's all for this week, folks. I look forward to seeing you next Friday, September 10th. Big day for me. I hope you have a wonderful Labor Day weekend. Stay well, everyone. See you next Friday.
If you liked this video, please follow us on social media and subscribe on YouTube. For more information, visit rielderinfo.com or call 401-585-0509. If you have any questions, email deb@rielderinfo.com.